What is the best way to diagnose and treat snoring? 1. Overview. Snoring is a hoarse or harsh sound produced by air passing through relaxed tissues in your throat, causing the tissues to vibrate as you breathe. Everybody snores now and then, but for some, it is a chronic problem. It can also indicate a serious medical condition. Furthermore, snoring can be annoying to your partner. Losing weight, avoiding alcohol close to bedtime, and sleeping on your side can all help to reduce snoring. Furthermore, medical devices and surgery may be available to reduce disruptive snoring. These, however, are not appropriate or necessary for everyone who snores. 2. Symptoms. Snoring is frequently associated with the sleep disorder obstructive sleep apnea, OSA. Not all snorers have OSA, but if your snoring is accompanied by any of the following symptoms, you should see a doctor for further evaluation for OSA. A. Observed breathing pauses while sleeping. B. Excessive sleepiness during the day. C. Concentration problems. D. Headaches in the morning. E. Waking up with a sore throat. F. Sleep deprivation. G. At night, you may experience gasping or choking. H. Blood pressure is high. I. Nighttime chest pain. J. Your snoring is so loud that it disturbs your partner's sleep. K. Poor attention span, behavioral issues, or poor academic performance in children. OSA is frequently characterized by loud snoring followed by periods of silence during which breathing ceases or nearly ceases. This reduction or pause in breathing may eventually signal you to wake up, and you may do so with a loud snort or gasping sound. Sleep deprivation may cause you to sleep lightly. This pattern of breathing pauses may occur several times throughout the night. People with obstructive sleep apnea typically have at least 5 periods during each hour of sleep when their breathing slows or stops. 3. Causes. Snoring can be caused by a variety of factors, including your mouth and sinus anatomy, alcohol consumption, allergies, a cold, and your weight. When you fall asleep and progress from light to deep sleep, the muscles in your roof of mouth, soft palate, tongue, and throat relax. Your throat tissues can relax to the point where they partially block your airway and vibrate. The more restricted your airway, the more forceful the airflow. This causes tissue vibration, which increases the volume of your snoring. The following conditions can cause snoring by affecting the airway. A. Your oral anatomy. A low, thick soft palate can constrict your airway. Overweight people may have extra tissues in the back of their throats, which can narrow their airways. Similarly, if the triangular piece of tissue hanging from the soft palate, uvula, becomes elongated, airflow is obstructed and vibration is increased. B. Consumption of alcoholic beverages. Snoring can also be caused by consuming too much alcohol before going to bed. Alcohol relaxes the muscles in your throat and reduces your natural defenses against airway obstruction. C. Nasal issues. Snoring can be exacerbated by chronic nasal congestion or a crooked partition between your nostrils, deviated nasal septum. D. A lack of sleep. Inadequate sleep can cause further throat relaxation. E. Sleeping position. Snoring is most common and loudest when sleeping on one's back because gravity's effect on the throat narrows the airway. 4. Diagnosis. Your doctor will examine your signs and symptoms as well as your medical history to determine the cause of your condition. A physical examination will also be performed by your doctor. To assess the severity of the problem, your doctor may ask your partner questions about when and how you snore. If your child snores, you will be asked how severe the snoring is. 5. Imaging. An X-ray, computerized tomography scan, or magnetic resonance imaging may be ordered by your doctor. These tests look for problems with the structure of your airway, such as a deviated septum. 6. Sleep research. Your doctor may recommend a sleep study based on the severity of your snoring and other symptoms. Sleep studies can occasionally be performed at home. However, depending on your other medical issues and other sleep symptoms, you may need to spend the night at a sleep center to undergo an in-depth analysis of your breathing during sleep via a study known as a polysomnography. During a polysomnography, you are connected to numerous sensors and monitored overnight. During the sleep study, the following data is collected. Waves in the brain, blood oxygen saturation, pulse rate, respiration rate, stages of sleep, leg and eye movements. 7. Treatment. Your doctor will most likely first recommend lifestyle changes to treat your snoring, such as A. Weight loss, B. Avoiding alcohol near bedtime, C. Nasal congestion treatment, D. Preventing sleep deprivation, E. Sleeping on your back should be avoided.